So in this video, we will look into some common reasons why hip dysplasia is missed. So this dysplasia is commonly missed in the female population. I think, looking from my years of experience, there are 4 or 5 key factors which stands out. Number one is lack of awareness among healthcare professionals. A lot of us have studied about pediatric hip dysplasia, but that's a condition which can also happen in adolescence and adult. So if you've got a female patient with chronic hip and groin pain, usually the typical onset is around the age of 25 to 28. That is one of the key differential diagnoses to be aware of. The second factor is the early symptoms are generally very non-specific. It tends to be more like muscular-like pain. They might come with a bit of gluteal overload, with a bit of hip flexor pain. So they don't seem to have that sort of classical intra-articular pattern. So most of the pain initially is more like muscle overload. So that can be quite misleading. So again, if you've done good rehab and it's not improving, that might be a suspicion that this could be intra-articular. The third is, which I've done on a separate video, is overlap. So a lot of these patients have very similar symptoms between hip impingement. So if you've got a young female patient with intra-articular hip pain, a lot of symptoms are similar with both hip dysplasia as well as hip impingement. So they can be quite tricky. So unless you have some imaging or radiography, it's very hard to say clinically, especially when they come with the irritability. It's quite hard to differentiate. And that comes nicely to the next point, is imaging. There's a recent study which I looked from Scandinavia which showed that less than 20% of patients who have hip dysplasia tends to get reported. And I would say that's pretty much similar in the UK as well, both in the NHS setting as well as in the private setting. Many times these patients will have 2 x-rays, 3 x-rays and reported as normal. And sometimes they rush into MRI, and the MRI is not very good at looking at bone morphology. It's really good at picking up like red flags like stress fractures, but if you're looking at bone morphology, usually the X-ray is the first place, and usually this X-rays is reported as normal, and that can be quite easily missed. So again, if you think it's intra-articular, the X-ray is usually the first place. And finally is a lack of awareness of specialist pathway. So both in the NHS and the private setting, this is a condition, unless you've got a lot of experience of seeing quite a bit, it's quite hard to sort of tease out. So again, working with sort of through the ESP road to the NHS, or if you're in London, myself and Callum, we deal with this sort of complex cases. So again, seeking somebody for a second opinion and saying, oh, this patient had 3 X-rays, reported as normal, am I missing something intra-articular? So again, part of the MDT is really important. So we don't miss these cases so that we can have the best outcome, either conservatively or surgically. Thank you.